I'm Dr. Chee Chee Pin, neurosurgeon at Gleneagles Hospital, Kuala Lumpur. Today, our session will be mainly discussing on cervical spondylosis. As we know, cervical spondylosis is a degenerative disorder of the cervical spine. It is mainly caused by degeneration as a result of age. As we get older, we have bony osteophyte forming at the cervical spine. This is due to the attrition, due to daily movements. Of course, it can be aggravated by exercises, and especially posture, which is unusual, like using handphone, iPhone, the iPad, and a computer. The excessive movement of the neck also can give rise to cervical spondylosis, like any injury or any strain when we are lifting heavy weight. When it's mild, it gives rise usually to neck pain, or when it's pinching the nerve, it can give rise to pain in the arm or the hand. Sometimes it gives rise to numbness. As it becomes severe, then actually it can give rise to weakness of the arms, and when it's compressing on the spinal cord, it can give rise to weakness in the legs as well. In severe cases, when the cervical spinal cord is compromised, it can give rise to paralysis of the arms or legs. Sometimes actually it can be worse, so that the patient might be wheelchair-ridden or even bedridden. Usually these are the late stages. The cervical cord compression also can give rise to retention or abnormal bowel or urine habits. And if that's happened, actually, then it is a situation of urgency that the spinal cord has to be decompressed. Now, in severe cases as well, when this is compressing on the spinal cord, there's especially C3, 4, 5, which is controlling the patient's breathing. The breathing problem can start in this type of patient. They have episodes of difficulty. And I have encountered in my practice before, where patients actually initially were seen many years ago with mild to moderate cervical spine problem, but later this problem progresses since they have defaulted. And when they appear later, some years later, in that case, like in particular, 10 years later, the patient presented with episodes of breathing problem or apnea. And in fact, in review of the cases then, of that case, it was obvious that the disease has progressed in time. With operation, in fact, the patient slowly recovered and had resumed his normal activities, including his breathing, resolution of his breathing problem. The in essence is that cervical spine disorder, especially in degenerative disorders like cervical spondylosis, cannot be taken lightly. There are many people, of course, were seen by us at early or intermediate stage, and they might have refused any surgical intervention. But these type of cases has to be followed very closely, and to avoid these type of circumstances from recurring again.